Academy of Family Physicians of India, Karnataka chapter. Yes, my dear friends, AFPCON Karnataka 2025, 5th State Conference Family Medicine Update, 2nd and 3rd August 2025 at St. John's Medical College Auditorium, Koramangala, Bengaluru, on the theme of At Every Stage, at Every Age, Family Medicine, Transforming Women and Child Health.
It gives me immense pleasure to welcome you all to AFPCON 2025, the 5th Family Medicine Conference of State of Karnataka. We are especially honored today by the presence of our chief guest, Dr. C.N. Manjunath, an iconic figure in Indian healthcare. Dr. Manjunath sir is a renowned cardiologist, the former the Padma Shri and the widespread national recognition. Sir is a champion with the values of family medicine, putting the patient first, focusing on
primary healthcare is back in focus and getting the attention which it deserved for a long time. This is my perception. So today I'll be reflecting upon the what are the changing paradigms and what the new dimensions have been added to the primary healthcare sector, and where does a family medicine specialist stands in this evolving primary healthcare landscape. So primary healthcare has many definitions. Since the new dimensions have been added, I thought this is the most appropriate definition. Primary healthcare is a whole of society approach to health and well-being centered on the needs and preferences of individuals, families and communities, and it addresses the broader determinants of health and focuses on the comprehensive and interrelated aspects of physical, mental and social health and well-being. And
now we have had a lot of scientific sessions and webinars, and over to this for this. We have bought it like a video. It's been a long journey, because whoever is associated with all these webinars and creation of physical meets are also busy practitioners. So we have had various topics, right from approach to hypothyroidism to medico-legal aspects in day-to-day practice, and we have had several training sessions and case presentations for postgraduates. We have been training them on various topics. We have also had a couple of opportunities to meet Dr. Dinesh Gundurao sir, our Principal Secretary Harsh Gupta sir, and in various occasions enforcing them on the need for family medicine. And before the Wonka International Conference recently we had in Sheraton Grand, we also had a walkathon where over 600 people from the public. As you all know that oncology is very important for primary care. We are seeing a lot of patients coming to us with end-stage cancer, early cancer, and it is our duty and responsibility to detect them early. And we have an exhaustive course for primary care physicians, similar on grounds with hematology course. I request all of you all to join this course. This is the course overview, and the details for registration are with. May I request Dr. Madhumita, who is our organizing secretary, to kindly acknowledge. Give a big round of applause. They are not for-profit organization who are family-centered and dedicated to improve the lives of those affected by dementia and their families. Established.
And this year we will take our 5th batch, but that's only 15 students. a drop in the ocean. But what is interesting is that this specialty has a significant demand as much as that of internal medicine, and that was a pleasant surprise. We all know that holistic and comprehensive care of our people can be provided or probably only at the primary care level. Who better to deliver it than the family physician? But over the years, with emphasis on and the glamour of specialization and the mushrooming of nursing homes and corporate hospitals,
Honorable MP C.N. Manjunath sir to give us pearls of wisdom.
In fact, it's a matter of pride and privilege to be part of this 5th state level Academy of Family Physicians of India at St. John Medical College premises. So I'm very thankful to Dr. Mohan Kubendra, the National President AFPI, and Dean and Director of St. John Medical College, Dr. George D'Souza, and Dr. Soumya Ramesh, the organizing secretary and president, Dr. Madhumita, organizing secretary, Dr. Hemavati, and the members from various other organizations, and the faculty, delegates, and dear friends, ladies and gentlemen. In fact, first of all, I really congratulate Dr. Mohan Kubendra and Dr. Soumya for taking the cause of family physicians to a greater heights. That is the need of the hour. Because today there is explosion of technology. There is also, we are talking about industrialization, we are talking about digitalization, we are talking about artificial intelligence. So on one hand there is explosion of technology, on the other hand there is also equal explosion of super specialty courses and organ specific specializations. So in a way, so see, during MBBS course we have studied pediatrics, we have studied obstetrics and gynecology, medicine, surgery, and there is a missing link. So still, despite explosion of technology, we are blessed with modern gadgets today. We have so many facilities, high-tech hospitals, we have gadgets, you have ECG, you have X-ray, you have angiogram, CT, MRI, endoscopies, robotic procedures, but still, the art of physical examination continues to be the pillar of our profession. Art of physical examination, art of taking history. I think 3 T's are extremely important, which is missing actually because we are blown away with the euphoria of super specialization and technological advances. 3 T's are still important for all doctors, whatever may be your specialization. That is talk, touch and treat. Talk, touch and treat. If you follow these meticulously, then the 4th T gets added, that is called trust. So this is one of the biggest problem what we are facing today. See, I think the family physician has got is the one who can really pass on all the information to the next level. Simple things they are going to treat, whether it is diabetes, whether it is hypertension, whether it is some respiratory illness or some small wound or some small dermatological issues. I think this is very much needed because otherwise what happens for everything, headache, go to a neurophysician, chest pain, go to a cardiologist, abdominal pain, go to a gastroenterologist. And yes, if there is some problem in the liver, you go to a gastroenterologist or hepatologist. So I think a super specialization becomes, yes, it is needed, I fully agree with that, but the basic foundation has to be a family physician. I think a time has come, we need to strengthen the family physician courses. We need to really strengthen the family physician, because that probably takes a 50% of the problems can be sorted out by family physicians themselves. Otherwise, what happens? They are referred for small illnesses, they are referred to a particular specialist, and they undergo a lot of investigations, whether it's required or not required, and out of pocket expenditure becomes extremely high. As a result, they will have problems. See, William Osler has said long back, who is a great physician? Who is a good physician? A good physician is one who treats the disease. A great physician is one who treats the patient. In fact, in my opinion, it is the family physician who treats the patient, and other physicians treats the disease. Because patient, in addition to the disease, has lot of unanswered questions, lot of emotions. He wants to know about the diet. He wants to know about whether he can work or not, and so many unanswered questions. And there may be a lot of emotional issues. There may be psychological issue. Just because patient undergoes surgery, undergoes an intervention, so those doctors do not have much time. They do not have much time to spend with the patient and their family. As a result, okay, patient has undergone a procedure, but is not satisfied, is not happy, because many questions that are going through his mind are unanswered. Because they want to know how far they can walk, whether they can drive, or so that is the reason. See, I think today we need doctors who can treat from pediatrics to geriatrics. At least simple things I am talking about. From pediatrics to geriatrics, and some malnutrition to obesity. On two extreme, malnutrition to obesity, pediatrics to your geriatrics, and also from simple tests to very high-end expensive interventions. So this is where a family physician can be a great value addition. You take, for example, our life itself. Earlier, India's strong mental backbone, India's strong health backbone was joint families. Joint families were the strong social, cultural, emotional backbone of this nation. Because in each family there used to be 15-20 people. They used to share. Work was shared. Emotions were shared. Even if there is any mental issues or any stresses, they were distributed and shared. And each joint family used to be a counseling center. Each joint family used to be a mentorship center, used to be a community center, used to be a kindergarten center. In fact, all children were taught by grandparents. Now we are talking about pre-LKG and LKG and preschool and all those things. So I think because joint families are breaking away, they are already broken. Only in few places in India we have some joint families. Joint families are real emotional cushion for the family. As a result, the stress-related diseases was far less, maybe fourth or fifth decade back. Because these joint families have broken or breaking away, I think a lot of people are facing stress-related problems or lifestyle-related problems. Today, what is the definition of joint family? Husband and wife living together is a joint family. Husband and wife living together. And to support a child, it is so difficult. Today, children education has become mother's examination. I think husband and wife working, have one kid, and they have to get up in the morning, early morning, 5 o'clock, and prepare breakfast for the kid. Kid won't eat. and won't take milk also. And already bus has, come in front of your house, and we are putting these children into the school buses as animals, and we are stealing those childhood. We are stealing their childhood. Yes, today in these metro cities, babies are born in motherhood, but we are taking away their childhood. So I think this is the basic issues we are facing. Allow more time, spend some time on. Nowadays what is happening, see in operation theatres we have what is called no touch method. That means we are not supposed to touch those instruments. We are not. So today I think examination has become no touch. I think that is not correct. So no touch method is wrong. So lot of investigations are done, and the most neglected person in the whole scenario of this evaluation is patient. Patient is not examined at all. Looking at images, deciding, looking at laboratory. So it should be patient-centric investigation. It should be patient-centric examination, and it should be, what is called disease-specific this thing. I think this is where we should understand, because we all consider certainly it's a noble profession. You should have a lot of patience actually. You should have patience for patients. Extremely important. And there should not be any ego clashes in their profession. I think you should not hesitate to take opinion of the others if I don't know. See, one of the best on diagnoses, if I am not able to diagnose, is I don't know. Let us consult somebody else. I think that is why for us the patient is very important. Patient life is very important. See, by saving one patient, you are not saving one life, you are saving the family. That one should always understand. And yes, certainly we'll take up this issue with the National Medical Commission, what best can be done for this. Of course, it's a long journey, and certainly it's going to be a long journey, because any new courses we are starting. It's a good thing is already it has started in medical colleges, but you have to encourage more medical colleges to start these family medicine courses. Even if there are, I think they have to have a department of family medicine. We can draw faculty from pediatrics, we can draw faculty from obstetrics and gynecology, or you can draw faculty from internal medicine. Then it becomes a family medicine. Of course, first 5 years and 10 years, nobody insists that the teacher should be qualified in MD family medicine. That is the honeymoon period to go, and certainly we can have that sort of a program. So
to honor our president to put the Petra and garland. We have
ಸರ್ ಈ ಕಡೆ ನೋಡಿ. ಓಕೆ.
ಫಸ್ಟ್ ಆಫ್ ಆಲ್ ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ಇವತ್ತು August 2nd and 3rd ನಾವು ಸೈಂಟ್ ಜಾನ್ಸ್ ಆಡಿಟೋರಿಯಂ ಅಲ್ಲಿ ಫ್ಯಾಮಿಲಿ ಮೆಡಿಸಿನ್ ಪ್ರಚಾರವಾಗಿ ಒಂದು ಕಾನ್ಫರೆನ್ಸ್ ಮಾಡಿದ್ದೀವಿ. ದ ಥೀಮ್ ಆಫ್ ದ ಕಾನ್ಫರೆನ್ಸ್, ಆಸ್ ಯು ಕ್ಯಾನ್ ಸಿ, ಅಟ್ ಎವ್ರಿ ಏಜ್, ಅಟ್ ಎವ್ರಿ ಸ್ಟೇಜ್, ಫ್ಯಾಮಿಲಿ ಮೆಡಿಸಿನ್ ಟ್ರಾನ್ಸ್ಫಾರ್ಮಿಂಗ್ ವಿಮೆನ್ ಅಂಡ್ ಚೈಲ್ಡ್ ಹೆಲ್ತ್ ಅಂತ. ಸೊ ಈ ಒಂದು ಮುಖ್ಯ ಉದ್ದೇಶ ಏನು ಅಂದ್ರೆ, ಫ್ಯಾಮಿಲಿ ಫಿಸಿಷಿಯನ್ಸ್ ಆರ್ ದ ಫಸ್ಟ್ ಪಾಯಿಂಟ್ ಆಫ್ ಕಾಂಟ್ಯಾಕ್ಟ್ ಫಾರ್ ಎನಿ ಇಶ್ಯೂಸ್ with respect to mother or child health, and we are the one speciality which can deliver a holistic, patient-centered, cost-effective healthcare. We are like friends for all the patients who can help from their birth till the end, and also help in end of life care. So ಈ ಒಂದು ಮುಖ್ಯ ಉದ್ದೇಶ ಫ್ಯಾಮಿಲಿ ಮೆಡಿಸಿನ್ ಪ್ರಮೋಟ್ ಮಾಡೋದಕ್ಕೆ ನಾವು ಎಲ್ಲ ಕಡೆಯಿಂದ ಪ್ರಯತ್ನ ಮಾಡ್ತಾ ಇದ್ದೀವಿ. ಅದಕ್ಕೆ ಈ ಸ್ಟೇಟ್ ಕಾನ್ಫರೆನ್ಸ್ ನಾವು we have held this state conference, and it is the 5th state conference which we are holding, and I have my organizing team, Dr. Madhumita, who is the organizing secretary here, and Dr. Hema, the scientific head for this conference. Over to Dr. Hema to tell a bit about the contents of this ಕಾನ್ಫರೆನ್ಸ್.
We had very important topics in the practice of family medicine, covering topic across spectrum of women and child health, like various stages during pregnancy, recent advances in delivery, approach to infertility, adolescent problem, and in the society there has been, increased acceptance of child adoption and going for ovum preservation. So we have talks addressing these issues, and in this conference all specialities are coming together: gynecologists, pediatrician, psychiatry, physiotherapists. So they are all coming together, and we are having a concrete discussion on all these topics. And through this discussion, the family physician, young doctors will gain knowledge, and basically it will improve the approach to patients and the health of the society.
ಈ ಕಾನ್ಫರೆನ್ಸ್ಗೆ CN ಮಂಜುನಾಥ್ ಸರ್ ಬಂದಿದ್ದಾರೆ, ಆನರಬಲ್ MP, ಮತ್ತೆ ಹಿ ಈಸ್ ಆಲ್ಸೋ ಅ ಡಾಕ್ಟರ್, ನಿಮ್ಗೆಲ್ಲ ಗೊತ್ತು, ಕಾರ್ಡಿಯಾಲಜಿಸ್ಟು. ಸೊ ಸರ್ ಹಿ ಆಲ್ಸೋ ಬಿಲೀವ್ಸ್ ಫ್ಯಾಮಿಲಿ ಮೆಡಿಸಿನ್ ಅಂದ್ರೆ ಇಟ್ ಇಸ್ ಒನ್ ಆಫ್ ದಿ ಆರ್ಮ್ಸ್, ಮೋಸ್ಟ್ ಇಂಪಾರ್ಟೆಂಟ್ ಆರ್ಮ್. ಏನಂದ್ರೆ ನಾವೇ ಅದು ಡಯಾಗ್ನೋಸ್ ಮಾಡಿಬಿಟ್ಟು ಯಾವಾಗ ಸ್ಪೆಷಾಲಿಟಿ ರೆಫರೆನ್ಸ್ ಬೇಕೋ ಆವಾಗ ರೆಫರ್ ಮಾಡೋದು. ಅಪಾರ್ಟ್ ಫ್ರಮ್ ದಟ್ ನಮಗೆ ಡೀನ್ ಬಂದಿದ್ದಾರೆ ಫ್ರಮ್ ಸೆಂಟ್ ಜಾನ್ಸ್ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್, ಅವರು ಫ್ಯಾಮಿಲಿ ಮೆಡಿಸಿನ್ ಪ್ರಮೋಟ್ ಮಾಡ್ತಾರೆ. ನಮ್ಮ ಆರ್ಗನೈಸೇಷನ್ AFPI ಮಾತ್ರ ಅಲ್ಲ, FFPAI ಮತ್ತೆ FPAB ಮತ್ತೆ IMA, ಇಂಡಿಯನ್ ಮೆಡಿಕಲ್ ಅಸೋಸಿಯೇಷನ್, ಎಲ್ಲರೂ ಬಂದಿದ್ದಾರೆ. ಎಲ್ಲರೂ ಅವ್ರ ಸಪೋರ್ಟ್ ನಮಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ. ಥ್ಯಾಂಕ್ ಯು.